And I see more people are rapidly joining, so that's great. Okay, so NHPHA began in 1992. So this year marks our 30th anniversary. So that's why we're kicking off this meeting with breakout rooms based on the decades of NHPHA. In addition to the service rooms of the decades, we'll also have a student poster session where the student poster winners will present their posters, and they are all live this evening. The breakout rooms will be followed by our keynote speaker, and then the presentation awards will round out our evening. So please sit back, relax, and enjoy the meeting. And I should add that, so Autumn has set up our breakout rooms. So here are the breakout rooms. So you can, like I say, you can choose where you want to start off, or you can stay the whole time, or whatever you want, but you just select the one that you want and move to it.
Okay. Well, everybody, I have the distinct pleasure of introducing our keynote speaker for the evening. So we are delighted to welcome Dr. Semra Aytur to be our keynote speaker this evening. Dr. Aytur is an epidemiologist whose research focuses on transformational resilience, which I'm sure she will define for us, but I find fascinating, and the relationships between environmental, social, and policy factors in preventing disease and keeping people well. She is a graduate of Brown University, Boston University, and the University of North Carolina at Chapel Hill. She has extensive experience with multi-sectoral team science projects that focus on socio-ecological systems and reducing health disparities. Dr. Aytur uses innovative quantitative and qualitative methods in her research. She has experience working in public health departments in 5 states, focusing on policies related to healthy eating, physical activity, mental health, chronic disease prevention across the lifespan. Most recently, Dr. Aytur helped to start the New Hampshire Healthcare Workers for Climate Action, a nonprofit consisting of bipartisan healthcare workers who are concerned about the impacts of climate change on health in both urban and rural communities. She's deeply committed to collaborative learning and community engaged research that supports transformational resilience and planetary health. So with that, I'd like to turn it over to Dr. Aytur with my gratitude for being here this evening.
I'm waiting for the screen share, it looks like, and I didn't know if we were going to do a land acknowledgement, but I can go with whatever. I'm waiting.
We are ready for Denise if she is ready, sure.
Okay. All right.
Nandakina, away, away. Holy, go on, gone, on, gone. Away. All you need to see now was. All you need to see now was. Nandakina, away, away. Holy, go on, gone, away. All you need can see now was. All you need can see now was.
Kwai Needleback, Indela Wasin, Denise Pulio, Sagamasqua,
Wood Delawasin, Paul Pulio, Sagamo, Kawasak Band of the Pennacook Abenaki people. Neo na ayan oranako nipi. Hello, friends. My name is Denise Pulio, and this is Paul Pulio, and we are the head speakers of the Kawasak Band of the Pennacook Abenaki people. We're speaking from our headquarters at Odanak-Hunnipi, which translates to the village at the narrowing of waters, now known as Alton, New Hampshire. We sang in Dakina, our homelands, thanks to all our relations, thanks to the great mystery of life. We're going to start today's presentation with the 30th New Hampshire Public Health Association Annual Meeting. Takes place virtually out of Pennacook, now called Concord, the traditional ancestral homeland of the Abenaki, Pennacook, and Wabanaki peoples, past and present. We acknowledge and honor with gratitude the Aki, land, Nebi, water, Olak-Wikak, flora, Awaasak, fauna, and the Alnombak, people, who have stewarded Pennacook throughout the generations. Kitsi Oleoni Kitsi Nawask, Ta Minikwil Daminana, Oli Don't Go On Gone. We give great thanks to the great mystery of life and that we remember still. Thanks to our relations. Thank you.
Thank you so much, Denise and Paul. I really, really appreciate that. It was such an honor. Thank you. I'm going to try to share my screen if that's okay with folks. Great. And let me put it into presentation mode. Moving all the Zoom things out of the way still takes a little while here. Oops, back one up. All right, I think we are ready. And I am just so honored to be here today. Thank you so much for having me. And I'm excited to share this presentation entitled Transformational Resilience, Leading the Path Toward Planetary Health. And if you read along with the land acknowledgement that Denise and Paul shared, that is what planetary health is. So in a way that could save me a whole spiel here, but I am just really excited that I think we are having opportunities to share in ways that perhaps we haven't had before. And I was in the breakout session for the current and future visioning and really just heard so many hopeful thoughts and ideas about building on our shared values and thinking about the ways in which we can support each other with one voice moving forward. So with that, I'm going to begin my presentation today. And I'd like to bring us into this with a quote from Dr. Martin Luther King that has really guided a lot of my work on environmental justice issues and planetary health issues. And this says, justice anywhere is a threat to justice everywhere. We are caught in an inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects all indirectly. And I love this quote. I think I see echoes of it in what Denise and Paul shared. And so much of this, I think, does guide us in our work in public health. So I'm always looking back on this quote whenever I need a little inspiration. I'm going to break my talk today into three main parts. First, I'm going to define some terms and build a common language for us. That is so important in transdisciplinary work because even when we think we share the same words, sometimes we might have slightly different interpretations. And some of the words that I use today might be very familiar, but our language is also evolving in public health, which I think is very exciting. And we're kind of at a moment where we can redefine some things and talk about what we mean moving forward. I'm going to talk about planetary health, syndemics, resilience, including transformational resilience. And what does the path toward planetary health look like? What is the face of this movement? And then lastly, probably the most important part, I'm going to talk about some partnerships and innovations for moving forward. Investing in the future, I think this was a theme where the breakout group that I was in was just really full of wonderful ideas and the energy around the future. and really being co-creators of that future, I think is palpable right now. So with that, we want to think about building adaptive capacity for healthy and resilient communities. So let's begin by defining some common terms and that language. So first of all, what is planetary health? This is defined as the health of human civilization and the state of the natural systems on which it depends. The word that is sometimes used in the scientific literature is ecosystem services. But like the quotes that you saw from Dr. King and what Denise and Paul read, this is about interdependence, intergenerational, our relationship with each other and with the planet, which is so front and center right now. It emphasizes balancing human needs with the preservation of the Earth's ecosystem services to sustain the health and well-being of future generations. And it really requires a multidisciplinary, cross-sector and trans-border approach to change mindsets and behaviors at every level, from global to local. I also love this term because, although it's a little bit jargony, it actually unites many of the different frameworks that some of us have been operating under already, such as eco-health, the environmental justice movement, One Health, or geo-health. And these are maybe a little bit more familiar to some people, but the planetary health framework unites all of them. I also wanted to introduce, or reintroduce, might be a more accurate way of saying it, the term syndemics, which is really the synergistic overlay of different epidemics that might be either infectious or chronic. And these are exacerbated by harmful environmental and social conditions that exacerbate risk. So when we think about the most famous pandemic that none of us can forget, the COVID-19 pandemic, that is overlaid on top of existing epidemics. The opioid and substance misuse epidemic didn't go away when COVID took us all sort of by surprise. The mental health and social injustice epidemic didn't go away. We have ongoing issues with chronic disease such as heart disease, cancer, as well as many other issues that relate to climate threat multipliers like climate change and structural racism. And these are the factors that heighten syndemics. Health inequities, we talked about the isms in my breakout group, structural racism, violence, and stigmatization. And even though this term was coined by Meryl Singer back in the 1990s in relation to the HIV/AIDS epidemic and the synergistic overlays of violence and substance misuse, we are really seeing this so vividly now. The other important thing about the syndemics lens to me personally is that it allows us to focus on addressing climate change and environmental factors as ways to prevent future syndemics, because a large proportion of emerging global disease threats are associated with climate-related zoonotically transmitted diseases. Up to 2/3 or even over 2/3 from the latest literature that I read suggests that zoonotic transmission, which means from animals to people, including SARS-CoV-2, these are the ways in which the most serious threats in terms of emerging infectious disease threats are likely to emerge. And we can think about addressing them at the same time that we address these other ongoing syndemics and forces of disruption. So when I hear things like, we have to wait to address climate change because of COVID, or it's a little bit hard to talk about racism right now because of COVID, it's really all related. And we can't wait to engage around any of this. We need collective action now on all of this. Let's talk now about some definitions of resilience, which is a term that has been talked about in so many different disciplines. That probably has really hundreds of different definitions, from engineering to public health to psychology. But I'm going to focus just on two as kind of bookends, I think, for our work together in this space today. The first is individual level resilience, which is really often what our mental health, clinically trained folks in the mental health care delivery space work on with their clients. It's defined as the process of adapting in the face of adversity, trauma, tragedy, threats, or even significant sources of stress. And this is from the American Psychological Association. So I'm not a psychologist, but I've had the privilege of working closely with social workers, psychologists, and others recently this year as part of New Hampshire Healthcare Workers for Climate Action, because we see the need collectively to bridge these individual ways of increasing our adaptive capacity to cope and to re-envision our best selves. And we need to bridge that with, as public health, we think about community resilience and population health strategies. So community resilience, turning to the CDC now, is defined as the ability of communities to prepare for, withstand, and recover from public health incidents in both the short and the long term. And the determinants of resilience include biological, psychological, social, and cultural factors that interact with one another and determine how communities respond to stressful events. So you see a little bit of the reflection of that syndemic approach and that interdependence here in this definition as well. I also, for quite a while, have been working with colleagues across our Department of Health and Human Services, our Department of Environmental Services. I was at an EPA Region 1 meeting yesterday, really focusing on the Building Resilience Against Climate Effects, or BRACE framework, which is the framework that the CDC uses to focus on emergency preparedness planning and climate-related planning using a 5-step process, which really leads iteratively from forecasting climate impacts all the way through to thinking about public health interventions, developing and implementing climate and health adaptation plans and mitigation plans, and evaluating impact and improving the quality of the activities. So I think BRACE has been in place in our state since 2013 and 14. But what I found in many of my conversations are, that the folks working on the mental health side, very much clinically engaged with patients, sometimes don't know about BRACE. And the people working on large scale emergency preparedness and public health resilience may not necessarily know about how our social work and psychology community is thinking about resilience in their terms, let alone how our engineers who build our infrastructure think about it. So I think a coming together to really think about how we can co-create resilience on all these different levels and build that collective voice across these different disciplinary and other ways of working together in different sectors. We need to bridge those silos and move forward together. So now the fun part. What is transformational resilience? So this is a term that was coined by a psychologist, Dr. Bob Doppelt, who has also worked with his state's BRACE framework, originally out of Oregon. Now he speaks nationally. And he has been really gaining the attention using this model, just one of many, but I think the ideas are really resonating now as a promising approach for taking care of ourselves, our own workforce, our families, while we continue to act as champions for planetary health, for environmental justice, both locally and globally. And I say this with great humility because I know how many of us are both incredibly inspired to do this work, and we're also tired, and we're also sometimes feeling vulnerable. And we need often to look to people who are also working 24 hours a day to lift each other up. And we often are facing really difficult situations with children, with elders, with people who are suffering in our daily lives, personally and professionally. So this ability, I think, to be honest with ourselves and to just come together as a community. We are lucky in New Hampshire that we are small and we can be there for each other in ways that I think larger, more dispersed public health communities sometimes would have a more challenging time doing. Transformational resilience, and there's a great book that's referenced at the bottom, which is not expensive, and a lot of these ideas are taken from there. It is prevention oriented. So what Dr. Doppelt said is, let's think about what we've learned from public health about prevention and think about a prevention oriented approach for dealing with chronic toxic stress, which can be caused by all of the things we're feeling today: social disruption, structural racism, the synergistic syndemics, environmental degradation, and climate change. We need to think as a prevention-oriented community which specializes in prevention. But I also heard from Bob Friedlander and several folks in my breakout group that this is at the same time an emergency. We need to respond as if it were an emergency, using that kind of urgency in our time scale, but we still want to, I think proactively. So maybe that's a challenge and an opportunity for us moving forward, is bringing what we've learned about prevention, but we also want to act with urgency. And this promotes thinking and acting in healthy ways, even amid ongoing, often unhealthy situations, such as the COVID-19 pandemic, but really asking us to find meaning, direction, and hope, often through the community building work that we can do together. So why is this important? So one of the things that Dr. Doppelt stresses is that, at least from his position in the past, what he saw is that traditionally, and this isn't true of everyone, emergency preparedness plans and even a lot of the BRACE framework in its original incarnation was focused mainly on physical illness and sometimes on property damage, with less of a focus on mental health. And we really need to think about bringing these prevention-oriented lenses forward. The terms that Dr. Doppelt also saw when he looked at ways in which mental health was discussed were terms like mental health first aid, which is important, it's great, but to Dr. Doppelt in blue, his words were that neither any kind of first aid reactive approach, which is great in an acute emergency, but we need an equal emphasis on proactively preparing people for psychological and psychosocial spiritual impacts that are already occurring and will be increasing. And then he has a really great section about building trauma-informed leaders, which I'm not an expert in that. We in public health can look to our social work community, our psychology community, our psychiatrists, and there's a place where, again, we can really, I think, be stronger together, needing to focus on prevention and capacity building across all levels of the socio-ecological model, and collectively being champions for planetary health. So I'm going to go through this part with a series of primarily images, but what does planetary health look like? What does that path look like as we move forward together? Starting with work from our New Hampshire Department of Health and Human Services, they use the CDC Social Vulnerability Index. So maps can be helpful just in envisioning where are the parts of our state geospatially that show pockets of vulnerability. So the greater orange, the darker orange color indicates more vulnerability based on the CDC Social Vulnerability Index, which is really a composite measure. So we can see pockets of vulnerability in the north, but we can also see pockets of vulnerability scattered throughout our state. And that is important because often, especially when we talk with national leaders, people tend to think of New Hampshire as a fairly affluent place. Our median income level is fairly high, but when you look under the hood, that's a term I often use with my students, is look at the car and look under the hood, look at those finer grained, more granular geospatial, census tract level, neighborhood level inequities and disparities. And that's where the face of inequity and health disparity usually shows itself in our state. So one example of how this relates to looking at mental health, and one of the BRACE indicators is extreme weather and storm events. So here's an example of how we could kind of bridge that thinking about mental health and resilience on multiple levels. And this is from research that I did with colleagues on a NOAA-funded project where we were looking at future and current storm events related to flooding and sea level rise. And what you can see in the map on the right, this is the Hampton, Seabrook, little seacoast area of our state. And in red is the most socially vulnerable census tract using the CDC Social Vulnerability Index again, and the darker orange, so parts of Hampton and parts of Seabrook. And these are the most vulnerable tracts where residents facing a lot of challenges live. And in blue, where it looks like a glass of water was spilled across the map, these are what our engineering colleagues built specific engineering models to predict where the greatest risk of future extreme flood events would occur, both currently and built out to 2060 for predicting future flood events. And you can see that the flood events illustrated by the blue on the map go right through the center of the most vulnerable tracts. These are tracts that already face high levels of substance misuse and mental health challenges that will only be exacerbated with climate sensitive kinds of exposures like flooding. You can see the resident-owned community, otherwise known as mobile homes, in the picture where we've already had severe flood impacts to those communities. And what we know from our mental health literature is that these events cast a long shadow. Even after the floodwaters recede, we are left with higher rates of suicidal ideation. After Hurricane Katrina, for example, the proportion of people experiencing suicidal thoughts doubled, and post-traumatic stress symptoms remained high 43 to 54 months after Hurricane Katrina. So these are often what I call the invisible impacts, because even after it looks like things might have gone back to normal, these are lingering, invisible, indirect health impacts caused by climate change and other kinds of stressors like this. We also have seen increasing focus, rightly so, from the best medical journals on people who are working, supporting our agricultural sector, our infrastructure, the people who are working on the front lines, both within our ranks in healthcare, as well as our food systems, folks that are often exposed to high heat and are really facing conditions that are, again, related to increasing heat events. This is an article focused on heat-triggered renal disease, and it just showcases how we have to be mindful of the effects on our vulnerable community members. So I want to kind of get into this thinking about ways in which to move forward. One of the things that has been emphasized in some circles is to even rethink the language we use around social determinants of health, which is a term I use all the time and we're so familiar with. But this article by Salerno and Bogart says, maybe we need to think about the fact that social determinants conveys some aspect of permanency, maybe conveying to some audiences that these are fixed, and these are not fixed. These are socially constructed kinds of things that really we need to reimagine the way in which people interpret socially constructed issues that deal with power. And I think a key here is that the social conditions that influence health today result from disinvestment and marginalization by those who have the power to make decisions. And we need to acknowledge that, and we need to understand that and address those inequities. Another way that I think the language from this article resonated with me is working from the inside out. So thinking about first looking inward and doing that reflective work, and then working outwards, having this honest examination of the words we use and the actions that we take. We also need to engage with people with lived experience. Change can only happen when the people who bear the burden of unjust policy decisions are at the table, are empowered, have their voices heard and acted upon. So it's no longer just about having a seat at the table. This move from justice, equity, diversity, and inclusion to belonging, the B that I've heard mentioned a couple of times, it's about being welcome at the table, not just having a seat at it, but feeling that one belongs and that we have improved diverse representation in the ways in which we work and make decisions. So I'm going to show you just in the Manchester community, the red and the orange are the most vulnerable neighborhoods, where the photos I'm going to show you next have been taken by youth about their own lived experience, focusing on what environmental injustice looks like to them. And I'm only going to show two from a photo voice project. This is a photo that a teenager took who lives in the areas where there is high social vulnerability in Manchester. A lot of new Americans, refugees, and immigrants living in often substandard housing. And the reason I share this photo is, again, in the eyes of this young person, we need to work together to fix this. And the story that was shared with this picture is, this is their playground. This is a young person who plays with their younger brother and sister outside, kicks a soccer ball around because they don't have a parent who can drive them to soccer. Parents are working 2 and 3 jobs. They don't have transportation to take them to after school activities. So this is their playground. Here we have a picture of another, the interior of a housing complex where kids were picking at the ceiling. And this is a home where there is lead paint still in the older structure of the home. So they pointed out that this was an issue brought to the landlord's attention over and over again. And eventually the family had to move out because the landlord never was accountable to the families, raising the alarm about the risks to their family for childhood lead poisoning. So those are just 2, but let's talk about partnerships and innovations, investing in the future, the part that we're really all here for. Just to really focus back on the transformational resilience lens, we can use adversity as a catalyst to find meaning, direction, and hope, and to remain actively involved in constructive civic activities like the space that's being created for us here today. This is another picture that I think illustrates transformational resilience in a way that a picture speaks 1,000 words. And this was taken by another youth participant who had come from a war-torn country to Manchester as part of refugee resettlement. What this young woman shared is I think the epitome of transformational resilience. She said, "I love this picture because I think it is beautiful. It shows the beauty of Manchester. It shows that some people's thoughts about the West Side are wrong. If you're looking for the good in something, you will find it. But if you focus on the bad, you will only see the negative." And for someone who had undergone that much trauma to be reminding us with those, I think those of us who are working in this community, coming from positions of privilege and power, to hear this as a reminder of how we can be our best selves was just so powerful, and I return to it over and over again. What can we do to kind of wind this up to build transformational resilience together? We can engage multi-sector partners working across these sectors, declare our values and our stories, and elevate the stories like those that I have shared, and like so many of you have probably heard from your own communities and constituents. We can help close the gap by changing the way people think about health and the environment and climate change and those relationships. Building community capacity and focusing on community strengths, not just their deficits, but so many communities have incredible strengths. Supporting trauma-informed and resilient-skilled leaders, that's something we can discuss later if we want to, and fostering links to institutional arenas for decision-making. That includes our planning processes, community health needs assessment, shaping the next New Hampshire State Health Improvement Plan might be a venue, as well as our regional planning commissions, the people that do planning, urban planning, regional planning, conservation planning, all of those are opportunities. And this, I'm not going to read everything on the slide. This actually comes directly from Bob's book, Bob Doppelt's book. But I think one of the things I do want to highlight is in terms of building trauma-informed skills, we have already started to do that in some concrete ways. And I'll highlight just one. The Behavioral Health Working Group of the New Hampshire Healthcare Workers for Climate Action found that there really was no white paper, no document, no infographic, no nothing for people that are already suffering from eco-anxiety or from other kinds of mental health related issues that have to do with climate change, with environmental degradation, with the syndemics that we're facing. And they created a brief guide to individual therapy for climate related mental distress. They wrote it themselves in the space of a couple of months, just informed by us identifying a need, public health at the table, clinical psychology, psychiatry, social work. And they made a guide that's a starting point. It's available now. We've shared it with students at UNH who are looking for a therapist that is climate informed and didn't know where to turn. So that's just one example. And I think as public health practitioners, we can think about moving toward a socio-ecological model of mental health and resilience that includes robust personal, social, and ecological supports, along with the client-centered trauma-informed skills that our clinical partners have at their fingertips. This is just, I think, a quick model. I won't read everything, but I've been working with this as something that's a work in progress to think about focusing on how we can improve what I see as differential exposure. We already knew about that, to both positive and negative impacts, differential susceptibility. So as we think about toxic stress being embodied and the ways in which our bodies and minds incorporate those stressors, that's where trauma-informed leadership and those bridges across clinical and public health workforces can be very influential. And then I think the key to it all is differential representation in government, in our institutions, working from local to global so that we have a more diverse workforce. Lastly, in conclusion, we need to care deeply, act collectively. Those are not my words. Those are actually the words of Elizabeth Watuti, a Kenyan activist at COP26, who spoke those words. And if you haven't watched her 4-minute clip, please watch it at the link below. It will move you. It will probably bring you to tears. And we need to generate structural change through community organizing and policy. I'll leave you with some great examples of the work that we're already doing. I'm sure I captured only the tip of the iceberg, but these are ways in which we're already coming together. The links are in my slides. And I thank you all for a wonderful time to talk with you. Thank you so much.
Thank you so much, Dr. Aytur. You've given us so much to reflect on. We had originally planned for a couple of minutes to debrief, and I'm conscious of the time. And frankly, I feel like 2 minutes would not even do us justice in trying to debrief. So if I could get Autumn to potentially skip our debrief questions. I know I look forward to talking with my friends and my colleagues who are joining us tonight to have those conversations in the form of a sidebar. We just wanted to take a quick minute before we move into the awards portion of the evening to encourage those who aren't already members of the NHPHA to become members. And if you already are a member, consider making a gift this evening. For those who aren't sure, you know, NHPA is not a trade association. We are a member organization. And what I like to say is, if you are a member of the public, you are a stakeholder in public health. And I can't think of a better talk to follow up that comment with than the one that we just got, because I think if you ever doubted that you had a role to play, you're not going to be able to hold on to that thought after tonight. NHPHA has been showing up in big and small ways throughout the pandemic. We've done a lot of excellent work. You know, this moment that we've been living in, this hot moment of 2+ years, you know, it has pushed us beyond our traditional footprint while requiring us to dig deep for our mission of promoting public health. We co-sponsor and facilitate the COVID Equity Task Force. Again, bullseye with Samra's talk. We've joined advocacy efforts to suppress the over 40 anti-public health COVID-related bills this session. And we're advancing priorities like food insecurity, family insecurity, strong public health infrastructure. And I think if you're here, it means that those are values that you share with us. So one little pitch to see if you'd like to become a member, renew your membership, or make a gift. You can go to nhpha.org to do that. On the landing page, you'll also see some links to our fabulous merchandise. So that's another great way to support the organization. You can get a great hat or a t-shirt or a tank to wear this summer and promote your support for NHPHA. So thank you so much.
All right, everyone. It looks like I am up. So now this portion of our annual meeting is really one of my most favorite parts of our annual meeting. It's our opportunity to recognize and celebrate all of the public health leaders in New Hampshire, but specifically those that our membership believes have gone above and beyond this year. And so Gail and I will be taking turns presenting our awards tonight. These awards include Student Research Awards, our President's Award, Friend of the Public Health, the New Hampshire Community Health Service Award, our Rising Stars Award, and our Roger Fossum Lifetime Achievement Award. So we're very excited to do that this evening. Gail, our current president, is going to kick us off. So I'm going to pass the baton over to her so that she can announce our Student Research Awards as well as our President's Award. So Gail, off to you.
Thanks, Ashley.
Of course.
So this year we had 5 undergraduates and 6 graduate students submit posters with audio. And the chosen winner for the undergraduates was Kylie Kastner from UNH. And the title of her presentation was Using Sustainability Tools to Support Resilient Communities. Of our graduates, we chose 2 worthy winners. One was Ava Elson from UNH MPH program, and her title was Community Needs Assessment and Provider-Centered Survey for Equal Care Fund. And the other winner is Haley Boyer, the Dartmouth Institute for Health Policy and Clinical Practice, the Healthy Brain Initiative, Subjective Cognitive Decline and Risk Factors in New Hampshire. All 11 posters that were presented will be available on NHPHA's website for you to view at your leisure for many, many, many days to come. So thank you all so much, and to all the students, especially to all their sponsors that helped them with this work. It was all very interesting, very well done. And I'm happy to present Lisa Bueno as this year's recipient of the President's Award because of her true devotion to NHPHA, especially over the last 2 years. As board president last year, Lisa led us through a period where we had no executive director, no past president, and 100% turnover in staff. Lisa volunteered over 20 hours a week, every week, to keep NHPHA going, updating our bylaws, our policies, keeping our grants going, training new staff, and never losing her sense of humor and passion for public health. I could not have completed this past year as president without Lisa's support. So thank you, Lisa, for your service to NHPHA over the last 10 plus years. Now back to Ashley for more awards.
So I think I'll get started. I think that we're starting with Bob Friedlander, right? Autumn. So while you find him, this year's Friend of Public Health Award goes to Bob Friedlander. I had the pleasure of having him in my breakout session earlier this afternoon. He's the founder and board chair of the New Hampshire Healthcare Workers for Climate Action. I have a little blurb to talk through right here. Many of you already know Bob. Oh, there you are. Hey, Bob.
Hey there.
Dr. Friedlander is a retired hematologist, oncologist, and palliative care physician. Bob focused his clinical and research roles on the human connections between patients, family members, and physicians. In his volunteer life, his long-standing interest in active listening, personal narratives, community organization, and working with diverse populations led to the founding of Innisfree, Cancer Help of New Hampshire, and Healthcare Voices of New Hampshire. Bob has helped amplify the individual and collective voices of a diverse cross-section of healthcare workers. It was in this spirit that he founded New Hampshire Healthcare Workers for Climate Action. And just as a reminder to folks, the Friend of Public Health Award is presented to a person or to a group, but in this case, a person who has been instrumental in practicing and promoting public health in the state. And I know in this past year, Bob, I have seen you in action. And I know that this group here absolutely will agree with me that you are a well-deserving candidate for this year's Friend of Public Health Award. So I don't know if you want to say a few words, but I'll pass the mic over to you.
Well, thanks so much. It's a real honor to receive this award. what I've tried to do in the last 6 months is really marry my community organizing skills to experts in various fields like public health. And through that relationship and those affiliations, come up with programs and events and direct actions that really advocate in meaningful ways for climate solutions. So I want to thank you all for being available and so willing to affiliate with our group, co-sponsor our webinars, and give us ideas and inspiration about how to move forward with respect to climate and health. So thank you all very much for this.
Great, Bob. Thanks for all that you're doing. Wonderful. So our next award is the New Hampshire Community Health Service Award. This award this year is going to John Susi, who is the Senior Vice President of Children's Services at Easter Seals. To remind the group, the Community Health Service Award is recognizes a for-profit business individual making a significant contribution to improving the health of New Hampshire residents. And I absolutely can agree that you are well deserving of this award, John. So I'm going to pass the mic to you and ask if you have a few words that you'd like to share with the group.
Yes, thank you very much. I'd never had a headshot before. And so when the pictures came back, I was texting my daughter that I looked a lot like Uncle Fester from the Addams Family. And sure enough, the Addams Family was on TV that night. So no, I'm very grateful to have received this award. This is such a fabulous event. I'm leaving here tonight with just so much hope, with such dedicated people doing so much work for the health of New Hampshire citizens and really all over. I got to, my breakout room was with the posters, and working with kids most of my life, I thought they were going to be posters, not just wonderful educational documents. And I'm so hopeful with the young people that are coming out that they're just going to continue to make this world just that much better of a place. So I just have to, thank you. I really, want to thank all the people from Easter Seals. Part of why I think I've been involved in this is we've just had such a hard time with the COVID virus. It was great to not talk about that much this evening, but I have to give credit to it. It really took all the staff from all levels to make sure that we kept all the people that we work with safe. So thank you again, and thank you for inviting me to this event.
Absolutely. Thank you so much for joining us. Thank you for all that you're doing, and thank you to Easter Seals as well. Autumn, could you please progress the slide? Thank you. All right, moving right along. So our next award is the Rising Star Award. This award honors a public health professional who has been in the field for less than 5 years and has both contributed to public health and has demonstrated significant potential, a true rising star in the field. Kelsey is a project director at the Institute for Health Policy and Practice at UNH. I've had the pleasure personally in working with her during my time at IHPP. She also is part of the NHPHA mentoring program and is an MPH candidate. So I know that we are going to see a lot of great things from Kelsey. Already has demonstrated great potential in the public health field. Kelsey, do you want to say a few words?
Yes, thank you, Ashley, and thank you to NHPHA. I'm really honored to receive the NHPHA Rising Star Award. And in my short career, it has been wonderful to learn and work with so many amazing individuals that work in public health. And there's 3 groups of people I really want to thank that have helped inspire me. And I really want to thank the UNH public health programs and faculty, both my undergraduate career and graduate, where my passion for public health began, thanks to the wonderful faculty that I had. I also want to thank Tammy Carmichael from the Partnership for Public Health, who I've been working with on my field study project this semester. And it has been wonderful learning so much from her, especially the lens of working at a public health network, which was something new to me in my current roles. And lastly, I want to thank all my amazing colleagues at the Institute for Health Policy and Practice, who I learned so much from each and every day. And I really look forward to continuing a career in public health. So thank you.
Thanks so much, Kelsey. Great. Right, our next award is the Raga Divinity, Equity, and Justice Award. This year's recipient is Allison Ryder. She is the Assistant Director for Community Equity and Diversity at UNH. As a reminder, this award was established last year, so Allison will be our second awardee, in memory of Raga Divinity, who served as the first coordinator of the COVID-19 Equity Task Force. The award is presented to an individual who has demonstrated passion, commitment, and dedication to promoting health, economic, and social justice for everyone in New Hampshire. Allison, would you like to say a few words?
Thanks all. I really just feel in awe to be in community with you all today, and all the words that Dr. Aytur was sharing, and Denise and Paul, and hearing about the work in our breakout sessions for the posters with the students. It's remarkable, and it really reminds me that when we focus on abundance, we can honor within each one of us that we have so much available, and we're all coming to this earth with amazing gifts. But the systems and society isn't designed to have us focused on the abundance that is available to each one of us. We focus so much on the scarcity. And for me, I personally got into this work focused on the system. As Isabel Wilkerson says in her book, Caste, ultimately we are all living in the same structure that has a rotting foundation. It is not built on a strong foundation. We all live in there. Some of us are closer to the effects of that, and appreciate Dr. Aytur's words about different communities, especially Black, Indigenous, people of color, who are so acutely aware of the rotting structure of our systems that we are in. But all of us are living within that house, and all of us have a responsibility. And so although I came into this work looking at it from a very systems level view, I've found within me that my ability to liberate myself from those messages is the most joy, and brings me in connection with amazing humans in a multitude of ways. And I really hope and believe that all of us continue to come together, and to get to the place of belonging, we have to believe we belong in our own bodies, in an honest place, and want to keep the message alive, and so that we can alter climate change, we can alter systemic racism, and we can all truly live in a more just and equitable society. So thank you all again for this amazing honor.
Thank you so much, Allison. Very well deserved, and we're so happy you were able to join us tonight. Great. All right. So I have the distinct pleasure for our final award of the evening to present Ken Norton, who many, if not all of you know, is the former director of NAMI New Hampshire, with our Roger Fossum Lifetime Achievement Award. This award goes to a public health official who has spent their life dedicating their efforts to public health, and have made significant contributions to public health throughout their career. And when we were thinking about who would be deserving of this award this year, Roger, you were top of the list, and we are just so grateful that you were able to join us tonight, and that we're able to present you with this award. So I'm wondering if you'd like to say a few words to the group.
Sure. And I'm speaking to you right now from the banks of the Winnipesaukee River, where I'm a settler. I can see it from my window. And as you heard earlier, the Winnipesaukee is part of the Pennacook Confederacy and the Abenaki and Wabanaki Nation. And I pay my respects to the elders past, present, and future who have been stewards of this land, and thank Denise and Paul for their leadership and their warm welcome today. In honor of these elders, I've worked for 30 years to promote conservation and recreation efforts on the Winnipesaukee River. I thank you for this tremendous honor. It's very meaningful to me in many ways, including that my bride worked closely with Roger Fossum on several cases when she served as the Belknap County Attorney many years ago. And I remember her enthusiasm about how outstanding he was to work with. I'm also deeply honored to be included alongside previous recipients of this award, many of whom have been mentors and/or role models for me. And I offer my congratulations to all of the award winners today. In addition to the support I've received from my family, I'd like to acknowledge and thank all my co-workers and volunteers at NAMI New Hampshire for the work we've accomplished together. And I especially want to thank My colleagues in the Connect Suicide Prevention Program, Elaine DeMello, Ann Douglas, and Patrick Roberts. The Connect program has had a positive national and international impact on suicide prevention and promoting healing and reducing risk after suicide. I'd like to make a few brief remarks, starting with that our healthcare system in the US is broken. Simply stated, we spend more per capita on healthcare than any other country in the world, and we have terrible outcomes. In 2020, the World Health Organization ranked the US as 41st in life expectancy. For infant mortality in 2019, we were ranked 33rd out of the 36 member countries of the Organization for Economic Cooperation and Development. There are a multitude of reasons for these, but a significant reason is we invest so little in prevention and public health efforts addressing social determinants of health. Included among these social determinants of health are racism, sexism, homophobia, transphobia, as well as significant economic inequities, which are at the heart of health disparities in our country. Mental health and substance misuse are significant public health issues in our country, as evidenced by the tragic rates of suicide and overdose deaths. And the isms are a significant contributor to mental health and substance misuse. People often reference stigma as being a root cause of mental health issues. I prefer to call it discrimination due to the multitude of barriers to accessing timely treatments and supports. We are only starting to see the impacts that the pandemic has had on children's mental health, and it is critical that we address this immediately as the potential for long-term impact is profound. Addressing suicide, substance misuse, and mental health, children's mental health effectively requires an investment and a commitment to public health. In spite of all these challenges, I remain hopeful that with statewide mobile crisis and the upcoming national 988 mental health crisis line, we're at a transformative point in mental health care in New Hampshire and nationally. And this transformation includes the engagement of people with lived experience at all levels of the mental health service delivery system. And although we live in very polarizing times, I believe there's greater recognition of the importance of addressing health disparities and promoting public health. I thank the New Hampshire Public Health Association for the important work you and all your members are doing, and for this recognition of my and NAMI New Hampshire's work. Thanks so much.
Thank you so much, Ken. With that, we will turn it over to Hanan to introduce our board of directors for next year.
I'm excited to introduce the 2022-2023 board of directors. And I hope I don't torture anybody's last name. Ashley Aytur, board president. Gail Tudor, past president, past board president. Anna Hollinger, board vice president. Nancy Frank, secretary. Marilyn Nehan, treasurer. Brian Legou, board director. Denise Polio, board director. Tammy Carmichael, board director. Jennifer Alfred Teester, board director. Suzanne Colliger, board director. Jonathan Stewart, board director. Joseph Lascas, board director. Lisa Pritzalaski, board director. Sharon Beatty, board director, and Jennifer DeMel, board director. We're very excited to have you part of the board. And just remember, I am at your service. And before I turn it over to Ashley, I just want to thank the staff for putting together the program, especially Autumn. She put a lot of hours into this, so kudos to you, Autumn.
Thanks, Hanan. Yes, Autumn is our behind the scenes guru of everything NHPHA related. And so I think she was having issues with her screen tonight, but Autumn is the reason that we are all here together today and that we don't have technical difficulties, etc. So thanks, Hanan, and thanks, Autumn. I do want to thank all of our staff again. I believe Melissa and Ellen are on tonight. We are so excited to have you on board, Hadan. Thank you so much for our interpreters tonight, for our keynote speaker, for the students who gave us so much energy, for all of our awardees, our sponsors, our members. We want to hear from you this year. I know that I'm really hopeful for the year to come, and I hope you are too. And so in the interest of time, I'm going to give time back, and we can't wait to work more with you this year. So thank you all again for coming tonight.